Hey everybody, my name is Kevin with Nursing KAMP.com, and today I'm going to teach you about SHAMLD C3, which is a reporting method that I use to teach my students how to give a report in a methodical but logical manner that gives all the right information and no fluff. So let's get right into it. All right, SHAMLD. All right, so let's start with the basics of it. Now, when we're giving a report, the first thing is to have some sort of method in the way that we're going to do this. And this method called SHAMLD C3 is a method I use in my practice in how I give report, how I organize all my content together. We're going to take each section, we're going to break it all down, and then we're going to see what's the most important, and then I'm going to show you how to format it. All right, so the first things first. So the first thing we need to do is grab a piece of paper like this. So basically normal regular sheet of paper, and you always want it to be no lines on it. And there's a reason for that. It basically works from right brain, left brain, but we'll talk more about that as we get into it. So you want one piece of paper that's clear on both sides. And then what you'll do is you're going to fold it up like that, and then one patient will fit on one section. What this will do is this is going to provide you the opportunity to streamline what you need to know and really focus on not writing it so much, but more focus on about what's going on in your head and being able to articulate yourself and what's going on. The second thing is that by looking at the report sheet, it's going to allow you to kind of conceptually think about the patient versus just writing down a list of different things. So it's very important on the format, how we format it, and how we get into this process. So that's the first rule. A sheet of paper, fold it in half, and you're going to start right here on the first part. All right, so we talked about the layout, one sheet of paper, we fold it in half, and the first thing we do is we're going to write up in the corner, we're going to write an S. I'm going to do this, H, A, M, L, D. So that would be a sheet of paper written like that. So SHAM, S-H-A-M-L-D. Okay, so that's the format. And you can see down here, see S-H-A-M-L-D. And now we'll get you organized on the basic content of how you need to structure your sheet. So let's talk about the setup. Now, we already talked about how it would be on a piece of paper like this, but as we move through it, we're going to kind of set up the paper. So we always set up the paper S-H-A-M-L-D line, okay? So SHAM-L-D, and C would be over here, all right? So S stands for statistics, H stands for history, A stands for assessment, M stands for meds of consequence, L stands for labs, D stands for diagnostics, and C stands for consults. So the first thing we're going to look at is called the S, or statistics. The most important information, the things that you'd want to know right up front. And the first thing you'd want to know is what room are they in? And that's what we call roomy Nagaduck speech. And what that is, just a mnemonic, remember what to write in the S. So room's important, right? We'd want to know what room they're in. Their name, obviously. Age is important. Gender, what are they admitted for? What's the date? What's the doctor? The diet, mobility, code status, allergies, precautions, obvious deformities, and that's it. And that would be your statistics. So let's start to go through it. And as we start to do roomy Nagaduck speech. So we set up the room, S-H-A-M-L-D. And we're going to be focused on S right now. So the first thing is room. Why is room so important? Well, I would want to know where that patient is. Why? I'd know how to go there. I'd know where to go, right? But why else is it important? Well, I mean, if I have 4 patients, all my patients are all on one piece of paper. Now, if I have a patient that's in this room here, over here, and then the other room is way down the hallway, I'd want to know that right away. So when I get my assignment, I would want to know where I am on it. Now, and that would be cluing in right away whether or not, why am I walking halfway across the unit for this patient. You know, why is it like that? Am I in the right zone? Where am I at the pod or whatever we're calling it? Okay, so room is important. So we're going to put this patient in room 406B, right? That would also be important, right? Next thing is the name. Okay, so this is a report sheet, right? This is for you, for your information. So this is not a medical record or anything like that. So always understand that principle. And so I usually just put initials on there, right? So I usually know my patient, and then I'll just, you know, put their initials there. Or I might just put their first name, and that's it, you know. And so we'll give this person the initials, and that'll be JB, okay, whatever. The next thing is age. So let's talk quickly about age and why is age so important right away. Now, if I'm on a tele floor and I think about age, right? So let's kind of play a little game here, right? So you're on a tele floor and you're working there. So telemetry floor, cardiac floor, you know, post cabbages, you know, drips, all that stuff. Okay, so let's go. 10-year-old cardiac floor, not most likely. 20-year-old, not most likely. 25-year-old, no. 30, maybe. 35, okay. Comorbidities, drugs, not really an MI, could be something else. 40, possibly. 45, female, might be getting a little bit closer. 50, getting a little warmer. 55, yes. 60, yes. 65, and so on. So working your critical thinking skills when you're looking at ages. You know, just don't take an age, oh, they're just old. You know, I mean, that doesn't mean anything, right? So you always want to make sure that you know, have an understanding of like what is the patient's age and where are they. So this patient is a 76-year-old. Okay, I'd expect that. It's not like, holy crap, patient's 76 years old. You know, I mean, I'm on a telemetry floor, so therefore I would expect that patient to be a little bit older as far as my demographic. All right, so that's important to know, age and also gender, right? So I mean, gender is important. I know this patient's a female, right? If they're male like that, then both of them are trans, right? So, you know, it's also important to follow your policy and what's important there, you know. So gender, is that important? Yes, because of comorbidities, right? So like a 90-year-old person on the floor, do you expect them more to be a male or do you more expect to be a female, right? And the most likely is going to be probably a female, right? Because, you know, females have a longer lifespan than males do. All right. So the next thing is admitted date. Right? Why is that important? Well, if it's a post-op floor, it's really important, right? So I'd want to know post-op day 1 right away, right? So, or if they're just admitted, right? Because basically with time is that, you know, if it's less than 24 hours, that's acute, right? So I want to really know that this patient just came in, right? Versus the patient's been here for 6 days. I mean, that's also important. Like, why the hell is this person still here for 6 days? You know, so when they were admitted is very important. Who they admitted to. Some places they want to know that. You want to know who are they to general staff or are they to, you know, do they have a private doctor? You know, not all units are that way. So, you know, a lot of times I don't really care who they're admitted to because I can see it on the chart. I don't need a nurse to be telling me who they're admitted to. I can figure that out myself. Next. What are they here for? Right, that's important. So the next thing would be, what are they here for? So the way I do that is I put a star right there, and then I put what they're here for. And this patient's going to be here for CHF, congestive heart failure. That's the admission diagnosis, right? So what if it was shortness of breath? Well, you're not admitted for shortness of breath, right? You have to have a diagnosis. That's the whole point of coming to the emergency room, is you could show up with shortness of breath or pleuritic chest pain unless it is diagnosed, right? That's what you're looking for. You're looking for that diagnosis. So if I had, for example, up here, I put a star there. So that opens it up. And if I put a star there, I've closed it. right? Which means that that's their diagnosis, right? So if you have patients here for shortness of breath, okay, well, it just has one star. You can't close that because shortness of breath is not a diagnosis. It's a symptom. So you'd want to figure out, is it pneumonia why they're short of breath? Is it CHF why they're short of breath? What's going on that this patient is short of breath? So that's an open-ended thing. So those are symptomologies. So diagnosis only goes there, and it gets closed by 2 stars. So admitted on, let's just say today's 8/8, right? So, August 8th. So I'm doing this in August, right? So admitted August 8th, CHF. Okay? So that's important to know. All right? So why else is that important? Well, I mean, on my sheet right here, I can look and say, oh, that patient's CHF. I know exactly where to look and see it right there. So I can go over here, oh, that patient's myocardial infarction. Oh, that patient's pericarditis, right? So I can look really quick. I look for those 2 stars, and I look for why they're here. Why else is that important? I have a tech who tells me, hey, come down to room 406B, right? So I have my report sheet right here. I can just pull that right out and say, oh, that's my CHF patient. Okay, high followers, shortness of breath, and I'm already in my mind about what's going on as I'm going down to that room. I'm already mentally preparing myself for that patient when I go down there. All right, so the next thing is, what's their diet? Okay, well, let's talk about diet. Right? If I'm on a cardiac floor, I'd expect everybody to be on a cardiac diet. I mean, that's not rocket science, right? So what do I care about? Do I care that they're on the DASH diet? Well, note to yourself, if you don't know what the DASH diet is, you need to look that up. Not really. So diet isn't necessarily, okay, patient's diabetic, they're on a diabetic diet. No kidding. I mean, does that really help? Do I need to know that? Right? And this is what the reporting is about. It's about differentiating white noise from true noise. Identifying what's really important to tell the person about. Because would you call up the doctor at 2 o'clock? Hey, doc, can I put this patient on a cardiac diet? No, right? So diet is important, but critically, is it really important? Not necessarily. What is important? NPO, that's important, right? If the patient's NPO, I'd want to know that, right? So that's important to know. So NPO. So this patient is NPO. Okay, here's a first rule with this, with the SHAMLD C3, is whenever you box something, it requires a second action. Okay, what does that mean? Second action. Okay, so think about this right now. Patient is NPO. What do you think? What's in your head? What do you care about if they're NPO? One who's less than 8? Not necessarily. They're NPO, they're NPO. Why? Why are they NPO? That's important to know. Because when are they going? Why are they NPO? Right? So this patient is NPO for a TEE. A TEE is a transesophageal echocardiogram, which is they shove a tube down the person's throat, so they sedate them, obviously, we just don't shove things down people's throat. So they sedate them, so it depresses their gag reflex, so they're able to put a scope down and then look at the heart, transesophageal echo. So they'll be NPO for that. Why? So they don't aspirate. If they had, 5, hamburgers before they went, they push something down their throat, that they're going to puke it all up. And so you always have that. So you want to put that person NPO. I'd want to know why they were NPO. Now, if they were NPO, so you never ever report a patient who's NPO and not why. And that's the most important. Okay. So the next thing is diet under what specialty? That's important to know. I mean, it depends on the floor, right? So sometimes they don't tell what specialty because if I'm on a cardiac floor, they're on a cardiac floor. I mean, that's what they're here for, right? So, but if you're on a GI floor, post-op floor, or a step-down unit or something like that. You know, sometimes they are admitted under specific specialties. All right, the next thing is code status. Okay. Is code status important? Heck yeah, it is. I mean, you would want to know that. So here's the rule with that. We just said the MPO like was boxed, right? Because it requires an action. If I was given report and I didn't know this patient's code status, I would have to write a box there, right? And I need to figure that out. That's my job, is to know what this patient's code status is. Because in the case of an emergency situation, and I run down to that room, I need to know what the patient's wishes are. And that's really, really important, because code status tells me what that patient wants. And I would want to know that, and that patient deserves that. So it's very important to know code status. If you ever get a report from somebody who doesn't tell you their code status, unacceptable. Absolutely unacceptable. You cannot work 12-hour shift and not know a patient's code status. You should know that information. So if you box it, figure it out. But this patient has a full code, so I'm just going to say put FC, right? So full code. Do I need to write out full code? No, right? FC is fine. I'll figure it out. If I'm given a report, I'll know FC means full code. What if I wrote out DNR? Right? Would I have to write out do not resuscitate? No, because if I saw DNR, I know what a DNR is. So get away from writing out all this stuff, because it's not really, really that important. Just write up your shorthand. Remember, this reporting method allows you to nurse and get rid of the clutter and just focus on what's most important of your patient. So let's talk about another thing that's most important, is allergies. Allergies are important. Why? I'd want to know that. Okay, so here's a process that you do with allergies. Okay, here's the rule. So we said that one rule was whenever you box something, you have another action towards it. Right? So like I said before, if you didn't know the code status, you put a box there, you need to figure out the code status. Right? If I boxed MPO, I boxed it because I needed to know why they were MPO. Right? So boxing means next action. Now, allergies are also important, right? But do I need to know 20 of them, right? So if you start giving me allergies, the patient's allergic to Zosyn, they're allergic to codeine, they're allergic to warfarin, they're allergic to Vanco, they're allergic to insulin, they're allergic to... I mean, I've lost interest. I'm not even listening because you're giving me too much information, and I'll never remember it. I'm going to go to the medical record anyways. I'm going to see all their allergies there. Okay, so here's the rule. If there's greater than 3 allergies, tell me the top 3 that you think I should know, then put a pound sign, right? So this patient's allergic to Zosyn, penicillin, and lisinopril. Okay? And a bunch of other things. That's why the pound sign is there. Is, you know, because I don't need to sit here and start telling you 20 different medications, right? I mean, just, hey, they're allergic to Zosyn, penicillin, and lisinopril, and a bunch of other things. Go check it out. It's on the medical record. Right? Because I'm not going to remember it, I'm not going to retain it, and it's also white noise again. You're just going to start talking, and I'm just going to glaze over because, you know, even if I'm not going to be writing down all this stuff because it's in the medical record. Okay, so all those allergies are not necessarily important during report. All right, so now if the patient just has 2 allergies, tell them the 2 allergies. If they just have 1 allergy, tell them the 1 allergy. But you don't write the pound sign. The only time you write a pound sign over here is if there's a lot of allergies, more than 3. Now, is that important to know? Hell yeah, it is. If the patient is, you know, 40 years old and they have 20 medications they're allergic to, I bet you they have a lot of comorbidities. So that's pretty important. But a patient having 1 allergy, 2 allergies, I mean, just remember that. You're going to see the medicational record, and you're going to be looking at that you know, when you're doing your medication passing and stuff like that. So, I mean, most important is just to keep a captive audience when you give them a report. Okay, the next thing, precautions. Okay, do I care about standard precautions? Of course I do. Everybody cares about everybody's standard precautions. But if the patient's MRSA, I'd want to know. Patient's COVID, I definitely want to know, right? If the patient has C. diff, I'd want to know that, right? Why? Well, I mean, it's going to tell me how my day is going to go, right? It's going to make me have perspective. For example, if I have 4 patients and I got 3 C. diff rooms in a MRSA room, like, why do I have all those patients, right? Does that seem like a fair report? Does that seem like a fair assignment? It's very clear, because that's what you want to be you want to always advocate for yourself. And one of the big things about nursing is advocating and being aware and looking for these things and not taking them lightly. So this patient has MRSA precautions, okay? And I'm going to box it. And the reason I box it again is why? Where is it? I'd want to know, right? And if you tell me they had MRSA precautions and you didn't know where, that's unacceptable. Because where is it? Do they have a wound? Is it in their ears? What's going on? You know, they colonized? I don't know. You're giving me a report. So it's important for you to tell me where they are. Okay. So what about MRSA? You know, why is that so important? Well, MRSA is important because I'd want to know, and I'd want to know where they are. So this person was positive in their ears. Okay. All right. The last part that we want to look at is called the beach. All right. The beach is what I call obvious deformities, things I would like to know before I got into the room. Right? First thing is B, blind. I'd want to know that, right? Because if I ran down to the room and they were blind, I'd want to know they were blind, right? If they had the right eye is blind, right? So I would write, you know, R blind. Okay, because this patient has a right eye blindness. I'd want to know that, right? So that's an obvious deformity. Also, ears, B-E, ears. Are they deaf? I'd want to know that too, because common sense, right? Next, A, amputee. I'd want to know that, right? So, you know, they had a left below the knee amputation. I'd want to know that, because it's kind of funny. You have a left below the knee amputation, but you just reported to me they had positive bilateral pedipulsus. Call it weird, right? So left below the knee amputation is important to know. It's an obvious deformity. Limb, you know, anything, obvious deformities. Okay, a chemo patient. I'd want to know that. Why? Because their labs down here are going to be all over the place. So that's very important to know, you know, especially as you start giving me rapport and I'm like, holy crap, all this stuff going on, listen to all these comorbidities happening with this patient and nothing's matching itself, and then all of a sudden, oh yeah, they're on chemotherapy. Oh, okay, well that makes sense. That's why the platelets are all over the place. That's why the white count's like this. That's why this is going on, this, that. You know, so that's an important thing to know. And if it's chemo, you want to know, do they have a port? Are they getting chemo now? You know, I would want to know that right away. This patient is not a chemo patient. And then the last thing is hemodialysis or peritoneal dialysis. I'd want to know that because obvious deformities. This patient is a hemodialysis patient. So hemodialysis and box it. And why would I box a hemodialysis patient? When did they last go? I'd want to know that, right? I'd want to know, you know, or they're going today, right? What's their schedule? You know, are they Monday, Wednesday, Friday? Are they Tuesday, you know, Thursday, Saturday? You know, I'd want to know that information. So, and I'm going to put today. okay, going today. Today's Saturday. Another thing that you might think about here is a mobility, fall precautions. You'd want to know that, right? So, I mean, right up front, you'd want to know if they're walking with a walker or with the cane. So mobility is always key on statistics, all right? So if they're bed rest, I'd want to know that right away, because I'm not like, oh, why has this patient been in bed all day, So I'd want to know that. So I always think mobility is the last thing. So there you have it. Room, nag, adducts, beach. All the things that need to be in statistics. Now this, this is just a thing that gets you out of your head and onto a piece of paper. See, this is the problem with reporting. Is a lot of times what happens is you have a computer screen and they tell you what to say and they tell you what you should do. But that is their process. So at the hospital that you work at, that's their process. Some hospitals even have report sheets that they print out and they're like, here you go. And then people read it and then it's like, you don't remember anything. You're just regurgitating. Work on your own process, your own way of getting your own information. I can go into any hospital and do this process. And it doesn't matter where I go because I know what information I'm looking for. So I start right away and I'm looking for this information. And I figure out on their computer how to get this information the quickest way. Now this report sheet, I can do about 5 patients in a half hour. So that's how quick you can do this. In the beginning, especially with my students, it takes them a couple of hours to do one, because they're working through the process. It's all new. A lot of times you're so used to seeing what they tell you to say that you don't have your own practice yet. And this allows you to breathe a little bit and to develop your own practice and to be independent in wherever you go, so that you're able to give a logical report to those and give them an efficient report that gives them all the right data and not some superfluous data like the family is this or the patient's this or this, that, and the other. This is only the facts, only the medical facts about the patient. So let's go through the report. What would it sound like? Okay, well, 406 I have a patient in room 406B. JB is a 76-year-old female admitted on August 8 with CHF, MPO for TEE in the morning, a full code, allergic to Zosyn, penicillin, lisinopril, and a bunch of other allergies. You can see it on the medical record. Positive for MRSA in their NARS, right eye blindness, a low left below the knee amputation for complications from diabetes. Patient is also a hemodialysis patient and is planning to go at 1,600 hours today. That's statistics. That's the first content. The next thing we're going to talk about is the H, and which is called history. And this is all their background, and that's the next video. So this is SHAMLD in effect, and this is what we're doing as we're going through a reporting method that you can practice, that you can utilize in your report to give a logical, methodical, and factual report based on the content that you need to know. I'll see you next time. My name's Kevin with Nursing Camp. See you next time. So if you're not a follower yet, please follow. Follow me on Instagram, Pinterest, and Etsy, or see me on Nursing Camp and then nurse on.